DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Folks, welcome to DocTalk. I'm Dr. Dan Thomson here. We're going to have a great show today. We got Dr. Dave Rethorst from Beef Health Solutions, which is a local veterinary clinic that also does some consulting nationally on preventative health. We're going to talk about calf scours, prevention, and treatment.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Dr. Rethorst, welcome to the show.
As always, good to be here, Dan.
Folks, this is my good friend, Dr. Dave Rethorst, who is a veterinarian and is the owner and operator of Beef Health Solutions. And Dr. Dave, just kind of talk to me a little bit about what your company's doing and the services that you're providing.
Well, Dan, we're providing traditional veterinary services to an extent in the Manhattan area and some outlying areas, but as you well know, my mantra is prevention.
Yep.
And what we can do to prevent things. One of my favorite slogans recently is because nutrition matters.
Yeah.
And the health of our calves starts when we turn that bull out. It starts at conception.
Yep.
And what we do during pregnancy impacts the lifetime health and performance of that calf. And we don't need to be using more vaccines and more antibiotics as a crutch. We need to figure out where we're messing up in management. And so that's what I'm trying to do is, I'm providing traditional services and testing bulls and preg checking cows, but I want to get back to, what are we doing to prevent things? Let's cut down on our antibiotic use. Let's improve our animal welfare.
You bet. Well, you've always done a great job with it. Your leadership within the veterinary profession and the care that you provide clients, it's going to be fun to walk with you and grow this company and watch where it goes, because folks, it's going to go big places. We're going to talk about calf scours, which you kind of led us right into this.
Absolutely.
And just talk a little bit about some of the things that when you're in general, we have different types of bugs that cause calf scours, right?
Right. We've got bacteria, we've got viruses,
parasites,
all sorts of things cause calf scours. But usually that's an indication we've got something wrong in the management system. If we dig deep enough, we'll find something wrong. But, we've got E. coli, and, E. coli can show up in a 24-hour-old calf, and extend on for a couple weeks. Our viruses, Rota and coronavirus, don't show up till 7 to 10 to 14 days of age and are protracted just because it destroys the epithelium of the gut enough they can't resorb fluids. We've got salmonella that's becoming a big thing. So we've got all kinds of bugs out there, but it's an indication of something else going on.
And when you're looking at that calf that's got scours, what what are some of the things that you use to kind of grade the clinical signs on the severity?
Depression, you know, if they're really depressed, dehydration, if that eye sunk back in their head, just attitude, have they nursed, is mama's bag full, and things like that.
So not only the diarrhea, but depression, anorexia, weakness, just
Absolutely.
general malaise and things like that. And if we do that, then we got to get them in. Folks, one of the things we're going to talk about here with Dr. Dave is he talks about prevention and moving forward. We're going to talk about some diagnostics next. Thanks for watching DocTalk.
The topic of vaccinology and stocker operations, I think important to realize how diverse the business models are in these types of operations. And the stocker operations is definitely a place where a one-size-fits-all vaccine protocol isn't appropriate. And it concerns me that a lot of stocker operations don't have a good working relationship with a local practitioner or a consultant. So I think there's tremendous opportunity to find the best vaccine fits for these operations. Now, if you're lucky enough to work with stocker operations, you're going to have a network of colleagues that you call. Some of those colleagues are going to be industry professionals and technical service veterinarians, and they play an important role of my access to information about products. So there's oftentimes I will call a tech service vet and ask for details or an opinion or background on a product. And we're lucky where we produce cattle, we have tremendous access to a lot of very, very good products. But I think a lot of people struggle with matching an appropriate vaccination protocol to the operations business model. So we're dealing with animals that are extremely immune compromised, or we're asking them to make a transition into a very complex business model. And there's really a lot to think about what's the best way to approach vaccine. So I think really the first step is your relationship with your operation. You have to sit down and understand the business model. And you need some leadership and some thought from the operators of these places before that decision's made. And I will tell you that the one we're visiting today, how fast cattle move through this operation is very important to how they make money. The other thing that we mutually agreed on is that when cattle leave this operation, we've done our best immunity-wise. You can't do any better. So they realized that building a reputation for providing healthy cattle to the feedlot that do well, that was going to pay long-term benefits. So we use quality products made by major manufacturers that will stand behind their product. We also look at innovative new products that hit the market. So we try to keep up the best we can, use the best technology that's available, and we buy our product from companies that'll stand behind them.
When it comes to stopping hornflies, cattlemen love their vet gun. Today they love it even more because vet gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst, and we're friends and colleagues and veterinarians, and Dr. Dave now has a company providing traditional veterinary services along with some of the preventative medicine services for cow herds locally and cow herds around the country. Beef Health Solutions is the name of that. And Dr. Dave, talk to me about, okay, so when we get into a wreck with E. coli, Salmonella, Rota, Corona. What are some things that you're going to do as a veterinarian as far as diagnostics? What kind of samples are we going to send in, and what kind of tests are we going to ask for?
Okay, first of all, on diagnostics, I want to get a good history of the herd. I want to see what the herd looks like, what the environment looks like, and then we're going to, obviously if we've got dead calves, we're going to get good specimens, get them into the diagnostic lab, get some culture work done.
Send the whole calf?
If you're close to the diagnostic lab, a whole calf works well. If you're not, learn how to do a good job at taking samples. Good fresh samples, isolated gut loops, swabs, fixed tissues, lymph nodes.
And see, for me, okay, so if I'm a cow-calf practitioner and I got scours going on, I have no problem just loading up myself and taking that calf to the D-Lab. I mean, a half-day drive or whatever is nothing compared to the way I care for those calves. So,
and it's, as our friend Dr. Spare just said, we're affecting the livelihood of those producers, and we have to show them that we care. So if it takes hauling a calf to the D-Lab, do it.
Yeah, get it in there. So one of the things that you mentioned was, history and premise inspection. And folks, we can't diagnose these things over the phone or over the email. As a veterinarian, you have to get on the ground, right?
Boots on the ground absolutely is essential on getting on top of these problems.
And so when you're having that scours problem, getting your veterinarian out to the farm sooner rather than later to be someone that can give you a second set of eyes. Timing is probably, as fast as neonates can succumb to these diseases, timing is of the essence. And so staying on top of it, working on preventative measures, but getting someone there soon rather than later is important.
Absolutely.
Dr. Dave, let's talk about some of the different samples that you might, after you get your samples collected, what are some things that diagnostic labs are going to do?
Okay, they can, probably the most common is what we call a culture and sensitivity for bacterial scours. Find out what bug's there, do a sensitivity on it, find out what antibiotic it's sensitive to, and hopefully it's one that's labeled for beef cattle.
Right. Yeah, that's important too.
Always helps. With fresh fecal samples, they can do virology studies, and see, do we have rotavirus there? Do we have coronavirus there? BVD,
yep.
All sorts of samples we can.
And a lot of times what we find is, like you said, is secondary to the immunosuppression.
Right. And it's the immunosuppression, the mismanagement, or something not quite right in management is the underlying cause of our scours.
Cool. When we come back, we're going to talk about how we treat calves with calf scours with Dr. Dave Rethorst and Beef Health Solutions. Hey folks, welcome to our Cattle First Minute, sponsored by Boehringer Ingelheim Vet Medica. And today we're going to talk about clostridial vaccines. And one of the things about clostridial vaccines is many times it's called, in layman's term, blackleg or something of that nature. But when you hear someone say, I'm going to give a 7-way blackleg, that is the vaccination for clostridials. Now, all of us that are watching this show are also vaccinated for a clostridial that's very common in our environment, called Clostridial tetani, and that is tetanus. So tetanus is a clostridial vaccine that humans and cattle alike receive. Make sure that we vaccinate our calves that are going to be housed on pastures that are high with the blackleg disease with a 7-way clostridial bactrin. We also want to make sure that we utilize that bactrin when they're going into a grow yard and again at the weaning process. When we want to use clostridial tetani or tetanus vaccines is if you're going to use the technique of banding to castrate bull calves. Always use the tetanus toxoid. Clostridial vaccines have been around forever. They're one of the most effective vaccines that we have in the world, and they work really well.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is, with TrichGuard, a herd doesn't have to feel like a house of cards.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst, who's a veterinarian and owner and operator of Beef Health Solutions, which provides traditional veterinary bovine care along with preventative medicine consultation for you and your herd. Dr. Dave, we get a calf, we've got calf scours, we've got the diagnostics, we have an understanding now of what's going to help this calf heal itself. What are some things that you implore or employ when we treat these calves?
First and foremost, Dan, is we've got to get these calves rehydrated. It's the dehydration that kills 95% of the calves. It isn't the bug. It's, like on Rota and Corona virus scours, it's the fact that those viruses destroy all the thousands, millions of little fingers of absorptive surface in that gut. They can't absorb fluids, so we've got to stay after them diligently with fluids, get them rehydrated, and use antibiotics more or less as a secondary thing. I'm a big fan of oral fluids. If we catch these calves early, get oral fluids in them, do it 2 or 3 times a day, use the proper fluids. We don't need to use the IV fluids, but if they get really down and depressed, then we have to use IV fluids on them.
Okay, so talk to me about oral fluids. What are some things that, if you go into the Orslins or go into a veterinary clinic, pick up one of these electrolyte fluid mixes for the calves?
Yeah, some of those are, I won't say some of them are poor, but there's some that are better than others.
Okay.
One of my old favorites, and I hate to mention.
No, you can mention.
Resorb is a really good one. Some of the others have, in my opinion, too much dextrose in them and will actually prolong the scours because that extra dextrose is pulling fluids into the gut. There's one I've been using the last couple of years, and I'm blank on the name of it right now, but it's kind of an orange-colored fluid when you mix it up, and it's really a well-balanced fluid and does a really nice job on these calves.
So when we think about fluids, and again, the oral fluids, you say 2 to 3 times a day, and probably going to use a calf feeder to
Yes.
get it down.
Yep.
Get it down, make sure that they get it. How much are you recommending that we give?
I like to use 2 quarts 2 to 3 times a day.
Okay. And remember, folks, if you want to know how dehydrated that calf is, just a simple skin tent. You pull that skin back, it should snap back into place. If you pull the skin on that calf and it stays and then slowly goes back, that calf's dehydrated and needs fluid help.
Needs some fluids. And if many times a depression, in and of itself is an indication of fluids. We've got some endotoxic shock going on. And
so the big thing on treatment, get them in a dry, warm place, get them on fluids, and then if there is a bacterial infection, an antibiotic that is effective, whether it's in a bolus or in an injection, utilize that. That's pretty much our, and then we're looking for endotoxemia as well.
Right, and I like to use the injectables. I don't like to use oral antibiotics because I want to take care of the systemic infection, but I don't want to mess up the flora in that gut any more than it already is. So
some of these bacterial infections can go away outside the gut, and so we have to treat the endotoxemia. So water soluble antibiotic that. But be sure to work with your local veterinarian. He knows the bugs, he knows the drugs, he knows your geography. When we come back, we're going to talk with Dr. Dave about one of his passions, preventing calf scours.
Join us April 6th for the Gardner Angus Ranch 40th Anniversary Spring Production Sale at the ranch near Ashland, Kansas. The sale will feature 342 registered bulls, 386 registered females, and 532 bred Gardner Angus influenced commercial females. The sale will start at 9 a.m. sharp. If you are unable to join us in person, you can bid online by going to liveauction.tv and register prior to the sale. At Gardner Angus Ranch, you aren't just buying a breed, you are buying a brand backed by 4 generations of disciplined seed stock production. We hope to see you April 6th at the ranch.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. This is Dr. Dan Thomson here with my friend and colleague, Dr. Dave Rethorst, who's a veterinarian and owner of Beef Health Solutions, which is a company that provides traditional veterinary health care for your herds and also provides preventative medicine consultation, animal welfare consultation, food safety, many different things that will help you and your herd put yourself in a position to be ahead of the curve. Dr. Dave, when we talk about preventing calf scours, kind of talk me through, if I was a producer sitting there and you're saying, hey, let's talk about calf scour prevention. You know, obviously, vaccinate, you know, it starts with that cow.
It starts with the cow, and I'll start with vaccine and then I'll digress a moment.
Okay.
You know, traditionally when we think about preventing, we jump to a vaccine, and there's several good vaccines out there, you know, take care of the E. coli, the rota and coronavirus. Sometimes we throw in a clostridial for the enterotoxemia. There's places that we have to use a salmonella vaccine. But all that aside, that prevention starts when that cow is pregnant, as I said earlier, because nutrition matters. You know, how we feed that cow, our nutrition program, protein, energy, trace mineral during pregnancy, affect that calf's immune system. The amount of protein in that cow's diet affects that calf's ability to absorb colostrum. It all starts there, and if we've got a ongoing scours problem year after year after year, you know, we need to go back and look at the whole program, not just throw a vaccine at it because, well, we got a rotavirus last year, we need to add a rota. Well, yeah, we probably need to add a rota, but we need to look at what else we can do.
Yep, and so when we look at nutrition and vaccination of the cow, we're also looking at the development of the immune system of the calf in utero, and then the immune system of that calf due to the proper colostrum intake. And so cow nutrition, colostrum. What about after the calf is born? What are some things we can do to set that calf up for success?
Well, first of all, ensure colostrum intake. You know, a study up at Meat Animal Research Center a number of years ago, calves that do not get adequate colostrum are like 3.5 times more likely to get sick as babies and 6 times more likely to get sick before weaning. So work on that colostrum. Then we can look at things like the Sandhills calving system, where, you know, after 10 days of calving in a pasture, we move the pregnant cows out, we leave the pairs in that pasture. That way those pregnant cows are calving on clean ground. We cut down on the environmental contamination of those calves when they're born. Another one of my pet peeves is biosecurity. You know, we lose a calf off of a first calf heifer or a second calf heifer, and we run to the neighbors, or we run to the dairy, or we run to the sale barn, and we buy a calf to put on these cows because we don't want them to run dry. You know, all you have to do is go through one wreck where you see somebody bring in a salmonella with a calf that they bought so that heifer didn't run dry. And you'll let an awful lot of heifers run dry rather than bring in salmonella or some foreign E. coli or a BVD.
Wow. Great information, folks. Great man here, great veterinarian. Be sure to work with your local veterinarian. And if you want to know more about what we do here at DocTalk, you can find us on the web at www.doctalktv.com. Dr. Dave Rethorst with Beef Health Solutions. I'm Dr. Dan Thomson. Thanks for watching DocTalk, and I'll see you down the road.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by MERCK Animal Health, the science of healthier animals.